everyone, and welcome back to my channel. Today guys, we are going to be talking and exploring the subject of sickle cell disease. Okay, sickle cell disease. I've briefly touched on anemia, and I think I touched on sickle cell disease briefly in one of my videos. I'm going to put the link in the description box below if you're interested in taking a look at that. But today's video, we're going to be talking about sickle cell disease, what it is, how to prevent it, what the signs are, the complications, and also it's very, very, very vital that you know about this. If you're not sure, get yourself tested so that you can be sure whether you've got the trait or whether you've got the disease. Okay, so sickle cell disease, guys, is a serious, very serious, inherited blood disorder where the red blood cells which carry oxygen around the body develops abnormally. For example, I have a trait. People who have the full sickle cell go through pretty horrifying, things. But as a trait, I find that I have low iron, and sometimes obviously gives me a dizzy moments where I feel really dizzy at times, where I have low anemia as well. So I'm just going to explain a bit more about this. The disorder mainly affects people of African, Caribbean, Middle East and Asian origin. Normal red blood cells are flexible and disc-shaped, but the sickle cell disease, they can become rigid and shaped like a crescent or a sickle. Okay, the sickle-shaped cells contain defective hemoglobin, the iron-rich protein that enables red blood cells to carry oxygen from your lungs to the rest of your body. Now, sickle cell disease is caused by a mutation in hemoglobin known as sickle mutation. The abnormal cells are unable to move around easily as normal shaped cells and can block blood vessels, resulting in tissue and organ damage and episodes of life-threatening and severe complications. Such episodes are known as sickle cell crisis. They can last from a few minutes to several weeks. It can cause an individual a kind of like indescribable pains anywhere in the body, results in a stroke or acute chest syndrome. I've had a couple of people who I know have ended in hospital because of that. Normal red blood cells can live up to 120 days. A sickle cell can live for about 10 to 20 days. That is pretty serious, guys. The abnormal blood cells also have a shorter lifespan and aren't replaced as quickly as normal blood cells. This leads to a shortage of red blood cells known as anemia. Okay, so what causes sickle cell disease? What actually causes it? It is an inherited disease caused by a defect in the gene. A person will be born with sickle cell disease only if two genes are inherited, okay? One from the mother and one from the father. A person who inherits one gene is healthy and said to be a carrier of the disease. The symptoms of sickle cell disease can be anemia, like I said, making you dizzy, kind of tired, short breath. The pain crisis occurs when the flow of blood is blocked to the area. And then you've got the acute chest syndrome when the body is under stress from infection or fever or dehydration, for example. And then you've got the stroke, which is like a sudden and severe complication. Jaundice is another thing as well. Sickle cell do not live as long as normal red blood cells, like I said, therefore die faster than the liver can filter them out. You've got the swelling of the hands and the feet, delayed growth of puberty as well. Complications of sickle cell disease. All major organs are affected by the sickle cell disease, unfortunately. The liver, the heart, the kidney, the gallbladder, eyes, the bones, the joints can suffer damage from abnormal function of the sickle cells. So you can get like increased infections as well. You can get like ulcers, bone damage, the kidney damage, eye damage, organ failure as well. It is, you know, it is hard, really, really difficult for those who have it and those who live with someone who has it as well. Living with a sickle cell disease is a lifelong condition. Honestly, living a lifestyle can reduce some of the complications as well. So as always, as we always say, eat healthy diet with lots of fruits, vegetables and grains, proteins and lots of fluids as well. Cold weather and taking congestants can cause constrictions to the blood vessels as well, so remember that. The treatment, you can have pain medication, you can drink 8 to 10 glasses of water daily, which is a yes. Blood transfusions may help treat anemia and prevent stroke. They may also use to dilute the sickle hemoglobin with normal hemoglobin to treat chronic pain, chest pain. Vaccination, antibiotics as well are used to prevent infections. Folic acid for severe anemia, regular eye exams, and then you've also got the bone marrow transplant that cures some people as well. So this is a very, very serious thing. You could end up in hospital for so many weeks. So helping yourself, even though there's no cure for it, helping yourself with a healthy diet, also doing things healthily, you know, exercise and taking it one step at a time. Don't go too full into, you know, workout. For me, I find that when I do workout, I do cardio, you know, I get tired quite quickly. So I try and move around and do things that doesn't make me get so tired, you know. And obviously trying to make sure you have that lifestyle of the fruits and veg and how eating healthily can also help with your situation as well. So I hope that helps you. If you know anything that I've left out, let me know, guys. And as usual, I'll see you in the next video. Feel free to ask me any questions, and let me know if there's anything you want me to cover as well. Okay, all right, take care. Ciao.